And joining us now to dive deeper into the subject of kids, COVID, and schools are Dr. Bradley Ackerson, Pediatric Infectious Disease Specialist with Kaiser Permanente South Bay, Dr. Daniel Stepenosky, Superintendent of the Las Virgenes Unified School District, and parent Nancy Sanchez, whose children are students in the Corona Norco Unified School District. Welcome, everybody. Thanks for joining us today.
Thank you.
All right, Nancy, I'd like to start with you. Okay, Nancy, we don't have Nancy there. Okay, Dr. Ackerson, we're going to go ahead and start with you. It seems as we get closer to the start of the new school year, we keep hearing about a step back in progress with getting the COVID-19 pandemic under control. There's, of course, the Delta variant that we've been reporting on. So what can be done to ensure things will be okay for students and their families?
That's a good question. We're actually really excited that kids are going back to school because it's important for their psychological health and also academic learning. However, there are a number of measures parents can take to keep their kids safe. And first and foremost, for the kids that are 12 and older, is vaccination. The vaccine is very effective, remains effective against the Delta variant, and it reduces the risk of becoming infected by between 70 and about 90 some odd %, depending upon which vaccine you get and how many doses you get. So it's very effective. The second is, as recommended by the American Academy of Pediatrics and CDC, is masking. Especially because many kids going K through 12 will not be able to have the vaccine because they're too young. And therefore, these additional layers are important. And masking is one of these layers. Masking decreases the risk of inhaling droplets that will make you become infected. But also, very importantly, they reduce the risk if you're infected and happen to not be symptomatic but still contagious, that you'll infect other people. And that's true for kids, too. And then we also know, finally, distancing at schools, which many schools will do.
And Dr. Ackerson, one other question to that. Have many of your patients, the parents, have they struggled with making that decision to give their kids the vaccine if they're 12 and older?
I think that, yes, many parents have been concerned. I am excited to see that in California, 50% of kids 12 to 17 have received at least one dose of COVID vaccine, and 40% are fully vaccinated. So I think many parents are realizing that literally hundreds of millions of people have received this vaccine. And so we're getting a pretty good idea of its safety record. And we certainly know how effective it is.
Well, that is good.
They're weighing their options.
That's definitely good to hear. Dr. Stepenosky, what so far has been the biggest challenge that you've had to deal with to get a plan in place for the new school year? I'm sure you're hearing from a lot of people.
We are. Thanks for having me, Juan. I would say the shifting guidelines from CDC and CDPH, but I understand it's a changing landscape, and the doctors have to change their advice, and CDPH has to adjust, and so we get that. So we're going to stay nimble and flexible and get moving. But the good doctor was right on. The vaccines are all about it. My daughter and I were in the vaccine trial. My daughter is going in Wednesday morning to be part of the booster trial as well. So I'm a big believer in the vaccines. We have almost 80% of our eligible students who are vaccinated. So we're very excited about that.
And Dr. Ackerson, what words of advice can you give parents who might still be on the fence about the vaccine?
I think to keep in mind the vaccine is very effective. It'll keep your kids from getting sick. And we know it'll keep your family safer. The parents should also get vaccinated. If you're vaccinated, you have virtually no risk, almost no risk of being hospitalized or dying from COVID.
And Dr. Stepenosky, will a hybrid situation still be an option for some families in your district?
It's a really good question. It's complex. The governor and the legislature actually took that option away from public schools towards the end of last year in the summer. So we don't have the ability to have that flexibility of a virtual academy like we did last year. We do have a dramatically expanded and structured independent study program available, and many districts do. But our hope, and the doctor said it earlier, is we want the students in the classroom with their classmates. The masks are a huge part of that. And we're excited to have our students back in person, in classrooms with their classmates and their teachers. That's the best place for them.
It sure is. And Dr. Ackerson, one more question here. Any chance a COVID vaccine could be approved for younger children anytime soon? I mean, are trials getting underway here?
Yes, the trials are ongoing. The FDA basically asked for additional data. And hence we anticipate it'll be sometime early next year when the vaccines will likely be available for probably 5 and up, most likely.
And one last question to both of you. Looking ahead, how do you see things shaping up? We'll start with you, Dr. Ackerson.
I think they're going to improve. I think that as more people become vaccinated, we will see less disease. Also, people would become more cautious. I think we all were looking forward to relaxation and going back to normal. And unfortunately, the Delta variant changed that a lot. And probably we might have rushed a bit in relaxing our efforts to avoid getting infected.
Yeah, quite the speed bump. And Dr. Stepenosky, final words?
Very optimistic. I mean, we have to all stay flexible and respond. And the Delta variant is here, and now we're responding, and we'll get through this together.
Excellent. All right. Thank you both for joining us today and lending your expertise and insights into coronavirus children with the new school year just ahead. I'm sure we'll talk to you guys sometime down the road. Thanks so much.
Thank you.